When we decided to try something different and innovative in our population, we really looked to telehealth, the telemedicine, as a way to deliver the kind of care that we felt was affordable, was accessible. We knew that there was high quality and high satisfaction for members who could access care like this in the convenience of their homes. The challenge was how would this work within our Medicaid population? We know we've seen it in the commercial population. How do we make it work for Medicaid members? And some of that's regulatory. Some of that is making sure that the way that the state allows us to care for our membership would be compatible with a telemedicine program. And there are rules around telemedicine in Medicare that we found did not apply to the Medicaid population. So we could treat our members more like a commercial market than a Medicare type of a population. And that really mostly revolves around some of the rules around telehealth, which allow a Medicaid member, to receive care from their home. That's different, that has historically been different in Medicare. So this was a big advantage. So now we're able to provide members the services they need in their home. And the second question was, are these services that we could be allowed to pay for out of state funds? And that was a conversation with the healthcare authority, with the state, and they could not have been more supportive. We found that we were so in line with the innovation programs that the state is now totally behind, providing innovative programs, innovative solutions to this membership. Our requirement is that the documentation is sent to the providers, patient's primary care providers, within 24 hours. And that document then is the conduit, it's the communication between Carina and our medical provider partners at Franciscan. So that communication is seamless, it is transparent, and it is the day after the service is provided. One of the things that is really important, we felt, with any program that we would promote and support, is that the provider-patient relationship is not disrupted. And we feel that the impetus and the focus of this program is not only to provide care in the moment when the member needs it, but it's also to be able to support the provider relationship in referring that member back to their primary care for future appointments, for follow-up appointments, and make sure that they get reconnected, if they're not connected already, with a doctor, with the primary care doctor at Franciscan. So this is an important piece of the continuity of care that exists between the Carina encounter and future encounters with the primary care providers. I believe that what is being done now is the natural starting point for many of these services. A lot of these can be positioned or bundled a little bit differently, and what we're doing now on the one-to-one basis is really the core of any of these other programs. The key is to make that connection between the patient in one location and the provider in another location. And being able to have that platform that is seamless is really the foundation. The virtual urgent care program as it exists today is really only the beginning. We see so many applications for telehealth services moving forward. Applications for the chronically ill, those who are homebound, to be able to access care on a regular basis through technology. That's simple, that's easy to use, great application. This service really helps us to reach that triple aim. We're always striving to reach a triple aim of high quality care, accessible care, care that's affordable, and we always want our members to be satisfied. And this service really fits that bill. It helps us to really reach those targets in a way that is incredibly convenient to the member. And we have early feedback saying that they've got great service, the quality of care is superb, and they have very high ratings at this point within our membership.